Okay, please state your name, your title, and your company affiliation.
Okay, so hi, I'm Paty Buendia, and I'm the CEO of Signed. We have a blockchain for healthcare company, really focused on personalized medicine and really focused on solving public health problems.
Awesome. Can you talk a little bit about your background related to blockchain and healthcare?
Yeah, so my background is I'm a bioinformatician. I've worked many years in biomedical research, and while doing that, I had a vision of the future of healthcare, which maybe many people share with me, in which I think people are in charge of not only their healthcare, their health, but also their health data. And I was trying to figure out a solution for that. And what is very funny, and this also describes our company, our startup, is that I was talking to my ex-boss, who brought me actually from Germany to the USA, and he is working on blockchain. And so I discovered that that actually solves most of the problems that I saw in achieving this future of not only personalized medicine, but as I say, where people are empowered to actually manage their health data and their health. And so, yeah, Amin is our chief technology architect, and we partner up in the company together with two other great people.
Great. So going off of that, talk a little bit about what you chose to talk about and discuss in the book, and why that was a topic that you decided to write about.
Yeah, so because of my background in doing my medical research and experience that I have in the past of writing contracts and grants for the CDC, Centers for Disease Control, and also National Health Institute, basically my focus is always on trying to come up with solutions for pressing needs, current needs in healthcare. And so when we started the company, and we started the company in April, we looked at some of the current problems right now. And one of them is, for example, disease surveillance. Another problem that, there have been two talks here, a talk and a round table, is opioid addiction. And another one is cancer survivors. It's becoming like a chronic disease. So we really focus on solving problems, health problems that are currently affecting many people, especially in the US. And so we've written some contracts and proposals for the different government agencies, and we were approached to write a chapter on that. And that's basically our chapter. It's on public health problems that the blockchain can solve.
Awesome. So in addition to the opioid crisis that we have going on, do you see any other pressing issues that need to be solved in terms of blockchain in healthcare?
Well, I would say what is interesting is that we can apply a particular architecture, the architecture and the infrastructure of the blockchain, and all the different components that are being discussed, for example, at this conference, identity management. Then they're using the blockchain as a health information exchange. Others are using it for electronic health records, an alternative to electronic health records management. Yet some other companies, I haven't heard that in this conference, but others are using it to do artificial intelligence studies, machine learning analysis on the health data. Well, all of these different technological components, architectures, give many possibilities to solve many different problems. And I would really just say it leads into personalized medicine. What does that mean? It's that you have the ability to collect a lot of data from different people, let them manage their data in their own private repository. They can share the data with other people, and you can use this data. They can share the data with researchers, drug companies, or to do some kind of prediction analysis. That way their data can help in the future for other people, other diseases. So There are other cases. In general, you can expand it. So for example, we're looking at opioid addiction, but we can expand it to all addictions. We're looking at cancer survivors, which are now being viewed as people with a chronic disease, because they have to maintain their health and go to checkups. And it has been predicted that there are going to be like 22 million cancer survivors in 2022. And so you can expand that to any other chronic disease, diabetes or HIV survivors or HIV patients, I would say, or people infected with HIV. And so any person that has like a chronic disease, and those are big issues in healthcare that affect also the cost of healthcare, because once someone has to monitor their disease, there is relapse and so on, and obviously causes a lot of healthcare expenses.
So when you when you look at the other hand and you think about the upside of blockchain in healthcare, what are some things that, looking into 2019 and beyond that, really excite you?
Well, it's really the possibilities. When I look at the future, see, I cannot just go excitement. I mix it with being careful. A lot of what we're doing right now is because we started this year in April. So we're a little bit late compared to many of the other companies here who started already in 2016, 2017. And what we're seeing is we're learning a lot from their own experiments and failures and little successes, but they're still, there's not one technology or one architecture that works, but you can already see that, yes, everybody's now using the off-chain, on-chain. They have figured that it's too difficult to put all the medical data in, in the blockchain, on-chain. And so it's more of, I do believe that this is it, that this can solve, as I say, the vision that I have for the future of healthcare, where individuals are in charge of the healthcare and prevent disease. But I don't know how fast it's going to happen and how many hurdles have to be surpassed.
So now, with all of that in mind, kind of in conclusion, is there anything that any comments or thoughts that you would like to give to the readers of this book?
That's a good question. I would have to think a little bit about that. I guess I would like everybody to think about maybe a little bit more focus on the actual aspect of health, of helping people, and some of the how to use the technology to help people live. A lot of people who are healthy forget that how good it is to be healthy. You always really only appreciate it when you actually get sick. You even just have to get a cold and you know how bad it is. And I want people to actually appreciate, especially with our chapter, appreciate how you can help. All this population of people with chronic disease and people with addictions, and beyond that, there are of course anybody who wants to lead a healthy life. So I think the chapter I'm writing focuses on that, on alleviate this all these problems in healthcare.
Awesome. That's all. Do you have anything else you want to add?
No, that's it.
Perfect.
Okay.